MS specialist nurses are the key health professionals for people living with MS. They provide information and guidance on decision-making and offer help with symptom management and psychological support. However, research from the Multiple Sclerosis Trust has revealed that there remains substantial shortfalls in provision in many parts of the country. Astoundingly, 2 out of every 3 people with MS in the UK live in an area without enough MS nurses. The MS Trust has been integral to the development of the MS nurse workforce over the last 20 years. Now they are determined to make sure no one is left behind by funding MS nurse posts in the areas of greatest need.
The new report that we've just published, first of all, has some good news in it, in that it shows that the number of MS specialist nurses across the UK has increased by around 12%. There are now around 280 MS specialist nurses across the UK. The much less good news is that there's still enormous variation between different parts of the country. So some areas of the country are relatively well provided for, but there are also areas of great under-provision. And in fact, about 2/3 of people with MS still live in an area where the MS specialist nurse has an unsustainable caseload.
There is a distinct lack of nurses, MS nurses across the UK, and I think there's a variety of reasons for that, but I think the main one is funding. I think there are just so many competing interests now in the NHS for funds, and I think there's also a lack of awareness sometimes amongst managers and commissioners, and I think that's really the role of the MS Trust, is to raise that awareness.
We have about 1,600 on our caseload. And I can see, anything sort of between 60, 70 patients a week. I manage by working very long hours, and because I have to. I would hate to think, if ever I was in a position that there wouldn't be someone there for me. So I find that difficult to say, well, I can leave that to tomorrow if I know somebody really needs to speak to me that day.
We really believe in people having access to the very best possible information and support from specialists who understand the condition to help them live as well as possible with their MS. More nurses for people with MS mean better care, and better care means people feeling more positive about life with their condition, more in control of their condition, and better outcomes. And that's about staying in work and staying out of hospital and staying active and engaged in the things that matter to somebody in their everyday life. The MS Trust is committing its time and expertise and resources to making sure there's more MS nurses in the UK, and we want people to join us in that. By giving their money alongside ours, we'll be able to make sure more people with MS get the very best possible care.
I'm 55 years old. I was diagnosed in 2005, so that's 11 years ago now. It's how many MS nurses are there to go around for the people that get MS? There's just not enough of them. Need more MS nurses. Okay, I'm maybe past the stage of the relapsing remitting, but I still need care. I still need somebody to talk to. Just getting the right people to do it.